We're here with Kathie Marini at the Joanie Abdu Breast Care Center, and we're talking about self-breast exams and how to do one properly. Kathie's going to walk us through it. Let's start with, where are the 3 places that we should be doing self-breast exams?
You can do a self-breast exam either in front of the mirror, you can do it in the shower, or you can do it lying down on your bed. All those positions work.
Is it important to do all 3 positions to
No.
readjust how the breast is lying on your
No,
body?
not necessarily.
Okay.
Yeah, as long as you're doing one of those positions and you're doing a thorough exam and you're doing them monthly. That's
So every 30
important.
days?
Every 30 days.
Okay, so let's talk about how you should be feeling for lumps. What is the proper method for doing a self-breast exam?
Okay, well, we have a little model here, and so we'll use this to demonstrate. But you take your middle 3 fingers, and you're not using your fingertip because there's a lot of nerve endings in that.
Okay.
So you're using the pads of these 3 fingers.
Okay.
So if you're actually doing it, you're going to use the opposite hand to the opposite breast.
Okay.
Okay, which just makes sense
Sure.
physically. And so we look at the breast as like a clock. That's the easiest way to remember it, with 12 o'clock being up here. So we would start at the top of the breast with these 3 pads. Would you like to try?
Sure, absolutely.
Okay, so taking those 3 pads
Okay.
and starting all the way out the top of the breast, and then you're just going to do like 3 nice and light circles. Circle
okay.
movements in the same area. So you're just kind of doing here, then
Okay.
pressing a little harder, and then very hard.
Okay.
So there's 3 different motions, and then sliding the hand, the fingers, all the way up to the nipple, and even over the nipple to
Okay.
make sure there's
So
nothing
not avoiding that
underneath.
area.
No.
Okay.
Then sliding again, just keeping the fingers on the breast at all times, and then just bringing it back, all the way back to the 1 o'clock. So you're actually, then once you get to the 1, you're sliding over again,
Okay.
and then taking it all the way down the 2.
So we're almost doing these pie sections of the breast as you
Exactly.
move around. Okay.
Every minute of it, because you want to get the entire breast.
Okay.
But that is not good enough. Okay, that's just the breast area.
Okay.
And the other areas that we want to do is all the way through the shoulder. So you take from the breast all the way up. So you're going to come up this way is what I usually teach people to do. All the way down, all the way up, all the way down, all the way over to the shoulder. Then coming underneath the armpit, because this is where our lymph nodes are. And so you want to make sure that everything is feeling okay in the lymph node area.
Okay.
Then taking it down the side of your chest all the way where your bra strap goes. So if you have large breasts, you might need to lift and to
Sure.
really be able to feel underneath, and then all the way back up.
So I mean, it's really from
So it's-
shoulders to
Through,
chest cavity.
Yep, through armpits.
Okay.
Yep, that
And
would
all
be
the
the
way around.
proper way to do it.
Okay. And we were talking about the different levels of pressure. Even looking here at the model, we can see different types of lumps at
Yes.
different depths.
Yes.
Is that the goal for making sure that you can feel
Light,
all of those?
medium, and hard.
Yeah.
Because some lumps rest on the surface and some go pretty deep.
Yeah. And some of these, I mean, this is the size of a pinhead, so they're not that big, but
They can
if
be
you're
very
going through and
small.
doing it properly, hopefully you can feel that.
Yes, yes. You should be able to feel. And what we tell women is you should know your breast. So every month, and I really encourage women to document it. You know, if you feel something at the 3 o'clock, mark that down. You know, and obviously you're sharing that with your physician.
Sure.
And so any change in a month, so say now you feel something at the 5 o'clock, you didn't feel that last month, that's a phone call to your doctor.
Right.
And we tell women not to panic. There are lots of lumps in breasts, you know, that are non-cancerous.
Sure.
But you always want to make sure you get to that physician with any change. And if you just feel in this one, this can give you an idea, like right here as you feel, it's rather a large, dense lump, which would be considered a fibroid. That's a perfectly normal finding. Right there, you just hit it.
That's the lump.
That's,
Interesting.
That's a lump that you would be concerned with. It's a sharp and very small.
Yeah.
And this one.
Sure.
They come in all different
Yeah.
sizes. And
But even the fibroid, if you didn't include the deep pressure, you wouldn't be able to feel that.
exactly. Exactly.
Well, Kathie, thank you so much for your insight. We appreciate it. And obviously, it's important to be
welcome.
doing these every 30 days, as
Yes.
well as doing screening mammograms at the age of 40 once a year, correct?
Yes, and we tell women to start in their 20s.
With self-breast exams.
With self-breast
All right.
exam, because cancer does hit women in their 20s.
Yeah, and it's something we can all do for ourselves.
Exactly.
And that's the most important thing.
Exactly.